The idea that giving to others can be good for your health can feel like a bit of a stretch, but a growing body of scientific research shows exactly that. It's now clear that doing good for others without any expectation of reward improves your physical and mental health and can even help you live longer. So what better way to do good than by sharing some of your blood, which is what I'm about to do. Instead of telling people to do it, just going ahead and doing it. So all yours, Amanda.
Thank you very much. Michael, please can I have your surname?
Surname is Mole.
And your date of birth?
16th of August, 1900.
Thank you very much.
Vanessa, why would anyone donate blood? I mean, why should we donate?
I think the simple reason people would want to get involved in donating blood is the fact that you know that patients are reliant on blood transfusions and you can make a difference to saving their lives.
Good to know that. And what are the criteria for a blood donor?
There's a minimum criteria. You would need to be between the ages of 16 and 65, weigh a minimum of 50 kilos, and be in good health, and obviously live a sexually safe lifestyle. Once you've met those requirements, you would visit one of our donor centers where you'll have a questionnaire to complete like you have, and a one-on-one interview with our nurse who will assess your health on the day.
Okay, and I assume by exclusion, you're saying sorry.
Yeah, I'm going to.
All right, here goes. Needle goes in, and that's not bad. It's actually not sore. I mean, initially as it goes through the skin, a bit of a burn, but once it's in, it's fine. Well done, Amanda.
Thank you very much.
En is nogal, ja, skrikwekkend om 'n dokter na het te steek.
Ja, dis baie erg voor jy plaas baie druk op my.
So Vanessa, by exclusion, I assume people that don't meet those criteria can't donate.
Yes, our nurses would obviously do an interview with you. Sometimes people are deferred for a short period of time based on medication that they're possibly on, but we will discuss that with you in the one-on-one interview, and perhaps you might have to return in 6 months. Some are deferred for life based on whatever the outcome is out of the interview.
What blood group is most in need?
Well, I think it's important to know that we want all South Africans who meet the requirement to donate. But when we go into shortages, it's really the O blood group that we talk about, because it's a universal donor, which means in emergencies, when doctors don't know what blood group a patient belongs to, O group is what they'd ask for.
O, you're so right. Yeah. And what actually happens to most of the donated blood? I mean, how is it used?
Well, contrary to what most of the people believe, it's not accident victims that most of our blood transfusions get to. It's mostly childbirth complications, gynecological complications. Then there's terminally ill patients that are reliant on blood transfusions. And that's where the greatest percentage of the blood gets to.
Wow. Any risks to the actual donor? I mean, to me as I'm sitting here.
There's absolutely no risk, provided you've been honest in your questionnaire and the test of your blood pressure was fine when you donated. Some donors do feel a bit of dizziness, but we do ensure that when you leave our bed that you're well. We do ask you not to participate in anything strenuous after you've donated, and that's just to ensure that you maintain a good balance through the day, and of course drink lots of liquid.
Absolutely. A question that everybody asks and is concerned about, HIV. Am I at risk of contracting HIV in donating blood?
Absolutely not. Needles are only used once, and thereafter it's incinerated in a safe manner, so there is no risk in contracting HIV.
Brilliant. And by the way, during a whole blood donation, only around 480 mils of blood is donated, which works out at no more than around 13% of your total blood volume. And after that, your body has an amazing capacity to replace all the cells and fluids that have been lost. By law, which is obviously why the law is there, we need to wait 56 days before donating again. Any pre-donating tips, Vanessa, before I get in and get the needle stuck in here?
It's important to have a meal at least 4 hours before you donate.
Okay.
So,
and December is traditionally the month that you have blood shortages. Why is that?
well, purely because people aren't donating. We require a collection target of 3,000 units a day around the country. And it seems from October up until the middle of January, this is almost impossible for us to collect. I mean, we make ourselves available at shopping centres for your convenience, and we have a good footprint around the country.
Or you'll even come into studio.
Well, like we have.
You know, knowing we've done something to improve the life of others not only boosts our self-esteem and gives us a sense of purpose, it also shifts our attention away from our own stresses and worries. So consider donating blood. Vanessa, thank you so much. Amanda, well done.